Well, hello. I'm Dr. Kathleen Muglia, and welcome to my Critical Reasoning Thinking Like a Nurse video. I wanted to create this video to walk you through ways to answer critical thinking questions on your nursing exams and on NCLEX. So the first thing I want you to think about when you are taking an exam is to think about what the question is asking you. And this may sound like, well, of course I'm going to do that. But a lot of students will get questions incorrect because they really didn't understand what the question was even asking. So before you even look at the answer choices, make sure that you are looking at the key words in the stem of the question. What is the question asking you? Use your scratch paper or your whiteboard next to you and write down quickly 3 to 5 words that are key to answering that question. Think about the patient's age. That's very important. If that is in there, that's in there for a reason. So you want to think about that. Think about if the patient has lab values that are important, numbers that are important, a chronic condition, anything like that. Make sure that you're writing that down on your scratch paper. Don't take too much time to do this, but do it quickly before you even look at the answer choices. Next, only use textbook knowledge. You really want to think about this is the ivory tower. This is the place where things happen the way that they should. So try not to use all of your clinical experience. I know that you have lots of clinical experience and experience as a certified nursing assistant or a patient care technician. So try not to use those real world examples, but only think about what is in your textbook. We do know that nursing care is different from one coast to the other, from one provider to the next. So NCLEX tests you on textbook knowledge, and so do we at your nursing school. If you are stuck between 2 answer choices, make sure that you are prioritizing. Make sure that you are looking to save the patient's life. Make sure that you are looking at Maslow. Think about the hierarchy of needs. The patient's physical needs need to be taken care of before the patient's psychosocial needs. And think about if you are stuck between 2 answer choices and you have to do one thing and then you have to go home. You have to leave for the day. You only have time to do one thing. What would that one thing be? What would save that patient's life? That's the correct answer choice. Prioritize. Many of NCLEX questions are priority questions. So that means that more than one answer choice is going to be correct. So you will need to use your critical reasoning in order to figure out, well, which one is the most important. So make sure that you are putting in those key words that you found in the stem. Most, least, requires more teaching, you're looking for something wrong, anything like that. Make sure first, initial action. Those are key words that you need to put in that stem of the question in order to answer it correctly. Remember the nursing process. Remember that it's assess before you can implement. You have to figure out what's going on with the patient first, right? So think about assessment as anything that's gathering data. So go through your answer choices and see, is this an assessment answer choice? Am I gathering data? Am I getting more information? Or is this an implementation answer choice where I'm actually doing something? Now, if in the stem of the question you didn't have enough assessment data to even figure out what was going on with the patient, you need to gather more data. You need to pick an answer choice that has assessment in it. And remember, even if you're doing something like sending the urine off to the lab, drawing blood to do an electrolyte test. Those are gathering data. That's going to give you more information. So even though it's doing something, it's not an implementation. It's actually an assessment. It's gathering more data. Remember, by getting to the right answer, you must eliminate incorrect answer choices. So just like you're doing a Sudoku puzzle, right? You have to figure out what couldn't it be in order to find out what could be the correct answer choice. So a lot of students will tell me, when I'll say, why did you pick that answer choice? They'll say, well, it sounded good. It sounded like something a nurse would say. Or it just reminded me of something I read in the text. Try not to do that. Look at the answer choices and figure out, can I eliminate this? Is it wrong for some reason? And if it is, eliminate it and don't go back. So you may want to write on your scratch sheet A, B, C, D. And then if you eliminate it, then you're done, and you don't go back and try and make it correct. You may end up with an answer choice that you don't like, that you wouldn't normally say, that doesn't sound like something that is correct, but if you can eliminate the other answer choices and you know that this one you can't eliminate, that it's probably the correct answer choice. Remember, don't ask why questions. Why don't we ask why questions? Well, it puts the patients on the defensive, right? So imagine this. You have caregivers bringing in their 3-month-old infant, and you say, why did you wait 3 days to bring your baby in with a fever? That immediately makes them think, oh my gosh, why did I wait 3 days? I feel so horrible. And you've broken that trust with them, and they think that you don't respect them. So we want to show compassionate care. We don't want to put patients on the defensive. We want to have a great relationship. So don't ask why questions. Don't ask yes/no questions. Well, why is this? Well, you remember, you want to gather data. You want to ask questions that gather more data, that give you more information, that can help you assess your patient correctly. So if you ask a yes/no question, all you're going to get is yes or no. But if you ask an open-ended question, then you know that you are at an increased chance of gathering more data and developing that conversation so you can actually get to the information that you need to properly care for that patient. Now, what's the one time that you must ask a yes/no question and it would be correct on an exam? You guessed it. It's when a patient is at risk to harm themselves. If they are, if you have a depressed teen come in and they say, I'm just really not feeling like life is worth it anymore, you must ask, are you thinking about hurting yourself? And if they are, then you need to obviously care for that patient. That patient needs psychiatric care. Document your findings. Document findings is a do-nothing answer choice. This means that you think the patient is absolutely fine and you have time to go to the nursing station and chart and write all about it. So if you think that that's going on with your patient, it may be perfectly appropriate, it may be correct, then you can choose the document findings answer choice. If you're concerned about this patient, if something is going on, if this patient needs something, if this patient needs more assessment, if you need to call the provider, do not pick the document findings answer choice. Call the provider or the physician is a pass the buck answer choice. So this is appropriate if whatever care the patient needs is outside the scope of the RN. So if the patient has a cast on and their toes are blue, it is outside the scope of the RN to take the cast off. You need to call the provider to get that cast off immediately. That would be perfectly appropriate. But if there is an answer choice that there's something within the scope of nursing practice that you can do to care for that patient immediately, choose that answer choice and don't choose the call the provider answer choice. Remember to go with your gut. If you are stuck between two answer choices, which one stood out to you like, I thought that was the correct answer? Many times students can trust their gut. Sometimes you can't, so if you're one of those students that you can't, then obviously don't. But many times students are able to trust their gut first reaction. And also remember to focus on the patient. If you have a patient that's asking your opinion as an RN, what would you do in this situation? Do not say, well, I would do this, or I think this is the best way to go. You want to review the options with the patient. You want to help them come to a decision that's right for them. Nurses practice with evidence-based information. They do not practice based on what they would do in that situation. Also, remember, even with pediatric patients, you want to focus on the patient. Depending on the age, you can ask the patient, even a very young patient, you can ask them why they came in to the office that day or why they ended up in the hospital. They will tell you as far as their developmental level will allow, but you do want to focus on the patient and not on the caregivers or the nurse. And that is it. Thank you very much for watching this video. Take care. Bye-bye.